How do you feel about melatonin supplementation, and does that reduce your body's ability to produce it naturally?
So two separate questions. So let's answer the second question first. So the good news is you can take as much melatonin as you want and your body is not going to stop producing it. We used to think it was similar to testosterone in men, where with men, if you start taking external testosterone, your body just stops making it. And so then you're on it forever. Not the case with melatonin. However, most people don't need melatonin. Most people don't realize that melatonin is only good for shift workers, like we were talking about, jet lag, something called REM behavior disorder, where you act out your dreams, and in some cases, ADD, ADHD, and then people with a melatonin deficiency, which, by the way, is a very small number of people. However, here's the big thing that most people have no idea. Melatonin affects birth control. It affects blood pressure meds, it affects diabetes medication, and it affects antidepressant medication. If I was on any one of those medications, I would have no idea because the medications don't talk about it and melatonin labels don't usually talk about it. So if you're taking any one of those 4 classes of drugs and taking melatonin at night, you are easily affecting that negatively, so that you're making the medication less effective, which means you have to escalate dosage, and now you have a secondary problem on your hands. You got too much going in. So melatonin, in many cases, I would argue, is not appropriate. However, man, it's popular. Holy cow, it's everywhere. And by the way, the dosages that you can find it in, it's all in an overdosage format. The correct dose is between 0.5 and 1.5 milligrams. Dude, you can't find gummies that are smaller than 3 milligrams, 5, 6, 10 milligrams. And so what happens is somebody grabs a 10 milligram gummy, they down it, right? And they start getting really vivid dreams. That's one of the side effects of overdose of melatonin, is extremely vivid dreams or nightmares. So the bigger thing to remember is melatonin is a sleep regulator, not a sleep initiator. So melatonin is not like a sleeping pill. It doesn't make you fall asleep. It makes your brain think it's bedtime. So that's very different. So let me give you another example of where you have two differences like that. That's like saying that appetite is the same as lunchtime, right? It's not. Appetite is that thing that grows in you and makes you want to eat. Lunchtime is that time of day when you usually eat lunch. That's actually how melatonin affects the time of day. It does not affect that initiation.